best way to think of them is when a patient has lost a tooth and they want to replace it. You think of the implant as being a man-made tooth root, the part that goes into the bone. And that gets placed, and it has to have a certain amount of time to heal, and then we can load it, so to speak, with a restoration that is basically a tooth that you build on to that, and it'll function and look just like a natural tooth. When I have patients that are looking to replace teeth, I tell all patients, and it's something for people that are looking to do implants or are interested in that, they need to see their restorative dentist first to be able to be sure that dentists can have the template made. Basically, they're going to help design and figure out exactly where they want that man-made tooth root or the implant to be placed, because they're the ones that's going to be restoring it. And they're going to be wanting to restore it so it looks good, feels good, functions well, and that's the way it's going to last the longest. Implants are not necessarily any more difficult to have the surgery done for that. I think most patients that say that it was much, much simpler than they expected it to be. And as far as the cost of it, there definitely is, you know, a little bit of a difference than doing, say, a traditional bridge or a partial denture or something to replace the tooth. But the thing that I like to think and talk to patients about as to why I would have it or would want my mother to have an implant versus any of those other restorations is that they're standalone. You know, a lot of them, if we're just replacing one tooth, let's say. And it's basically, implants don't get decay. And they typically don't get gum disease, so it's going to be one time in the mouth, and they're so successful, 98–99% successful, that we can expect that implant and that crown to be there for your lifetime. Versus if you had a bridge to replace that missing tooth, you know, once you lose one of those teeth has a problem, that whole thing has to come off and be replaced. And unfortunately, crowns and bridges and things like that don't last a lifetime. That if you invest in the implant in the first place, then probably over your lifespan it's going to be less costly to you as far as replacement of that one tooth. But the initial investment might be a little bit more. And it's not significant enough in my mind that I wouldn't go the implant route if it were me. Yeah, actually, most patients feel like the implant is the closest thing to feeling like their natural teeth. It's not something that you need to take in and out if you're going to do a partial denture, you know, something like that. And you can floss between the teeth versus if you had a bridge in that area where you just built two crowns together and link the fake tooth in between, you're not going to be able to floss between those teeth. You're going to have to do some special home care to do that. Not that you can't do that, but the nice thing is it really gives you an opportunity to maintain things in a much simpler way.